Think testosterone is just for men? Think again, ladies. Testosterone is very important for women, and it's time to start talking about it, researching it, and normalizing it. I'm Dr. Yvonne Karney. I'm the hormone locksmith. Let's talk testosterone. Testosterone happens to be the most abundant sex steroid in women. Premenopausal women have 3 times more testosterone in their bodies than estrogen. And yet we don't know that much about it for women. We don't know even what normal range is, let alone optimal. This is important. Testosterone is very important for bone health. In fact, testosterone is 3 times more effective at maintaining bone density than estradiol. Testosterone is important for muscle, mood, memory, decision-making, libido, that get up and go. If you're not depressed, but you just have a lack of motivation, you might have low testosterone. We know that testosterone levels start to decline as early as age 40. It's not the same as estrogen with this abrupt decline at menopause. The levels start to decline slowly over time and sometimes more rapidly over time. But it's not like a fixed point in time as with menopause and estrogen levels. There's several issues with measuring testosterone and establishing a normal and then an optimal range in women. Issue number 1 is the philosophy that normal is good enough. And how normal range is set is typically measuring multiple people in the population, plotting them out on a statistical scattergram, and then taking the data that accounts for 90% of the population and calling that normal range. Well, that's not optimum. 90% of the population is not optimum. So choosing which women to check levels on is a huge issue when trying to decide what the ideal testosterone level is for women. In fact, some labs go down to 0 for free testosterone in women. 0. Really? You don't think testosterone is important for women? In those cases, how could you ever have low testosterone? Because you can't go lower than 0, and if normal range goes all the way to 0, then you're SOL. The next issue with trying to establish and measure in women is that the levels are low, 10 times lower than men. So men need 10 times more testosterone than women. And the initial studies and laboratory testing, they didn't have the accuracy at the lower levels. We're talking picograms per milliliter. That's a tiny amount. And we have to have accuracy in our measurement systems in order to do that. This gets a little sciencey, but the original studies used something called a radioimmunoassay, and it did not go to the level necessary to distinguish women's levels. Now we use mass spectrometry, and that is much more accurate at low levels. So that's an improvement, but we need to make sure that when we're looking at studies, which method did they use? The issue is that when you have such small margins, the margin of error of the lab test could completely wipe out what the range is for women when we're dealing with something as small as a picogram per mil. Most of the current labs for free testosterone use a reference range of 0.6 to 6.4 picograms per milliliter for free testosterone. But I've seen labs go down to 0.1 and some even down to 0 as the lower limit of normal. The third issue with establishing this reference range for women is there's not that many studies that did it. And what did they use as their inclusion criteria? So there's 4 studies that I researched that looked at, in the last 30 years, reference ranges for testosterone in women. The years these studies came out was 2005, 2011, 2012, and 2019. Now, interestingly, when we look at the inclusion criteria for women to be included in these studies, one of the inclusion criteria, the main one, was that they were having normal cycles, normal periods. And then exclusion criteria, meaning if they had this thing going on, they were excluded from the study, was PCOS, because we do know that PCOS is associated with potentially higher androgen levels. So basically, if you didn't have PCOS and you had regular periods, you were a candidate for inclusion in this study. Testosterone does not regulate your cycles. What does it matter if someone has regular periods? That is not where testosterone has its effects. So how many women who already had low libido, fatigue, brain fog, but their periods were regular, so they were included in this study, and that means that many of the women in these ranges probably were actually struggling with low testosterone, and yet they were part of what was included in the normal range. That's exactly why we cannot use normal range as optimum. So there's this huge gap. There's this missing piece of what actually is optimal for testosterone in women, and we need to figure that out. A completely different issue, but still along the same lines, is women not getting appropriate treatment for low testosterone. There currently is no FDA-approved product for treatment of low testosterone in women. There's androgel, which has testosterone for men, and there's androderm, which is a patch for a men, but women need approximately 1/10 the dose. You tell me how to do 1/10 of a pump of androgel, and you're going to cut your patch into 10 pieces. There's no guarantee that the hormone is evenly distributed across that patch to be able to take 1/10 of the dose. So we really need to have something available. And the good news is we do. We have compounding pharmacies. I don't know why there's this horrible bias against compounding pharmacies. 150 years ago, that's all we had, and people did very well with that. They trusted their pharmacists to make medications at the right dose that were customized to the patient. And that's what compounding pharmacies do. So don't throw them out. Right now, that's the best alternative for testosterone therapy in women, because we certainly don't want to try using 1/10 of a pump. Not only that, but the thing I love about the compounding pharmacies is that you can make sure that there's no ingredients that are harmful, like parabens or phthalates or colorings or fragrances. We don't need that in our medications. And yet a lot of the traditional medicine pharmacies use those things. We use compounding pharmacies at Vitality Renewal, and we have an excellent relationship with multiple compounding pharmacies that we put a lot of confidence in. So we use the pharmacies, we monitor levels, we'll use serum testing, we use saliva testing, we use urine testing, which is the best way to establish, actually the only way to establish how you metabolize the hormones. We monitor total and free testosterone. We monitor sex hormone binding globulin, which is very important because if you have high sex hormone binding globulin, you can have a normal total testosterone, but it's not available to the cells because it's bound up by the sex hormone binding globulin. And guess what causes high sex hormone binding globulin? Inflammation, liver issues, toxic overload. We really need to establish a system that looks at levels in the blood with a good reference range, but we also want to look at the symptoms of the woman. And there's not a lot of data out there as far as what levels of testosterone have been found in women who have good libido, good muscle mass, good brain function. And then what is the level at which, if they do get symptoms of hyperandrogenism, we don't want that. We don't want to turn into a man, not necessarily, right? Not transgender, but we don't want to push the envelope, but we want to be optimized. And there's not enough data in that realm. Look, if I were to give you a man's dose of testosterone, you would feel really good for about a month. You would come in and you go, gosh, my libido is better. My energy is good. I've been making decisions. My brain is functioning and I feel great. But guess what? After about a month, you'd start to have hyperandrogen symptoms. You'd have chin hair growth. You might have a male pattern balding where you're losing hair at your temples. You might notice that the other areas where you apply, if you're using a cream, that you have thicker hair. And a very serious side effect is enlargement of the clitoris. So it actually starts to enlarge, and that's what transgenders use in order to try to develop something that looks like a penis. We don't need that if we want to stay women. But we do want the benefits of testosterone, and we need more data. We need to have a study done that's going to look at What are the best levels? When do people feel the best? And at what levels do they start having problems? And here's where the hormone locksmith comes in. You need healthy cells in order to be able to respond to these hormones. You need optimized vitamin D or the testosterone can't do its job. Do you even know your vitamin D level? So many people don't, and that's one of the crucial lab values that we check on our patients. If you have massive inflammation from either gut problems or toxic exposures, then your hormone receptors get damaged from that inflammation because they sit on the cell membrane and they're encased in a bath of fatty acids, and these fatty acids get oxidized by toxins and it loses their shape. So if the cell membrane loses its structure because of toxic damage, the hormone receptor loses its structure. And if the hormone receptor loses its structure, you have rusty locks. And if you have a rusty lock, you can have all the testosterone keys out there that are perfectly forged, but they're not going to open the lock because the lock is rusty. So we really need a whole person approach. There is new developments in the last few months, and that is that a company is going into and applying for phase 1 trial through the FDA for testosterone in women's dose. So that's exciting. The topic is gaining traction. However, it's also concerning because the company wants to use testosterone with a deuterium molecule attached to it. The goal of this is that the deuterium will prevent aromatization of testosterone to estrogen. Deuterium in elevated concentration is toxic to our mitochondria. Our mitochondria make energy. Do we really want to start using something potentially long-term that is toxic to our mitochondria? Look at the prevalence of chronic fatigue syndrome and other things that are mitochondrial disorders. Most women who have low testosterone are already struggling with fatigue. Do we want to potentially add an ingredient in a medication that could make fatigue worse by interfering with mitochondrial function? This is the work of Stephanie Seneff from MIT. She's done a lot of research on deuterium and how it interferes with normal biochemical pathways, especially the making of ATP or energy in the mitochondria. So deuterium is heavy hydrogen. It's an isotope of hydrogen. The issue is that it won't kill you, but it could certainly lead to significant inflammation that suppresses mitochondrial function. Well, if you have mitochondrial dysfunction, you're going to be at risk for immune system problems because your immune system is one of the biggest users of energy in your body. Look, the CDC even estimates that 60% of Americans have at least one complex chronic illness, and 40% of Americans have more than one. Do we really want to add more to that burden? We know that complex chronic illness is from an accumulation of toxic load. That is one of the fundamental beliefs of functional medicine. And most of these people don't have one massive toxin exposure. They have a little bit of this and a little bit of that and a little bit of this and a little bit of that. And every single one of the toxins that they've been exposed to individually could be under the toxic at levels greater than. It's not harmful, but it doesn't take into consideration total toxic load. And so do we really want to add long-term exposure to deuterium for testosterone therapy in women? I say no, especially since their primary justification for putting deuterium in the medication was that it prevents aromatization. Now, aromatization means that testosterone is converted to estrogen via a pathway, a chemical pathway. Why do we need to prevent that at physiologic doses? Well, because they say estrogen causes breast cancer in their original analysis of giving the reason to the FDA. Well, we just disproved that long time ago, and the FDA finally last summer lifted the black box warning from estrogen, that we know it doesn't massively increase your risk for breast cancer. So why would we use a potential toxin to decrease aromatization when we know aromatization is a physiologic process and estrogen is not dangerous? That doesn't make sense to me. especially when it's available already from compounding pharmacies in the forms of creams and pellets. Don't throw out the pellets and the compounding pharmacies. Just make sure you go to a practitioner that knows how to evaluate you and your levels and to make the appropriate decisions with you. So really, the only people that would need to avoid the aromatization in estrogen are those that have estrogen responsive breast cancer. And those women could be covered easily using Dr. Rebecca Glazer's method. She did multiple papers using testosterone pellets and anastrozole to prevent aromatization. We don't need to use some toxin like deuterium to prevent the aromatization. And that's a fraction of the women who have low testosterone. Bottom line, ladies, if you've been told that your testosterone is normal or that you don't need to check testosterone because it doesn't matter, and you struggle with brain fog, fatigue, you feel like your body composition is changing, you're not responding to exercise, you have low libido, you have decreased sensation during sexual relations, you have less enjoyment, those are all symptoms of low testosterone. So you need to find a doctor who will listen to you. You need to get tested. You need to have the test interpreted related to how it relates to your symptoms and optimal levels, as opposed to just this huge black hole of normal range. And stay tuned, because I am so passionate about this that I am designing a study, and at Vitality Renewal, we're going to be participating and initiating a study to be able to prove that the normal range is inadequate. And we want to really look at women who feel good and are on testosterone therapy without androgenic symptoms, and what are their levels. I don't know this yet, but I have the feeling that it's going to be significantly higher than what we're currently calling normal range. So stay tuned.